right, so good afternoon, everyone. My name is Rachel. I'm one of the pharmacists here at UF Health in Jacksonville, and I also work with Gator Care. So I know an insurance that hopefully a few of you guys have. So John with Wellness asked me to talk about some heart medications today. My email is on the presentation, so if you guys have any questions that you think of afterwards, or even if it's like a question you don't necessarily want to bring up to the whole group, feel free to shoot me an email. I'm pretty much always available on there, can get back to you within a day or two. So today we're going to talk about a few things. And if you have questions as I go, we are having like some mouse difficulties, but just throw it in the chat box. I might not be able to look at it until after the presentation though. All right. So what is heart disease? I know for a lot of you guys, this is going to be a pretty like redundant review, but just we'll quickly go over it before we get into all the medications. So in general, heart disease is basically what happens when the blood vessels within your body either become damaged or diseased. So things that can cause this are things like fats and lipids, so triglycerides, LDL, and these things can build up and cause what we call plaques, which is basically just a large area of these fats and lipids. Because of this buildup, that leads to blocked blood vessels, so blood can't get through like it should, and can cause things like heart attacks if it blocks blood flow to the heart, or strokes if it blocks blood flow to the brain. And can also cause things like blood clots as well. Another term that you might hear somewhat interchangeably would also be coronary artery disease, pretty similar as heart disease, so just two kind of interchangeable terms. So why do we care about heart disease? Because it causes so many problems within the body. So we talked about already heart attacks and strokes and blood clots, but it can also cause arrhythmias, which are basically abnormal heart rhythms. So the main one that most people have heard of is atrial fibrillation, or often called AFib for short. Pretty common, especially in older patients. And they can also cause heart failure, which is a reduced function of the heart, usually to pump or fill with blood. So a lot of like long-term side effects from heart disease that we want to try to avoid. So medications for heart disease. So obviously this is why I'm here to chat with you guys today. So there is many medications for heart disease, more than we're going to talk about today. So if you guys have any questions on additional ones, like I said before, feel free to reach out. We're just going to talk about the most common things today. But big things to remember before we kind of jump in is every person's medication regimen is going to depend on how heart disease specifically affects them. So I always tell patients, don't compare what you're on to what your husband or your wife is on versus your family members, because everyone's different and everyone's going to need different things. There are a lot of overlap with a lot of these medications. So you might see some common themes, but don't be alarmed if you're not on exactly the same regimen as a friend or family member, or even a coworker. And then another big thing to remember is that a lot of patients are going to need more than one medication to help with the various ways that heart disease might manifest for them. Unfortunately, we don't have one drug that takes care of all of this. If we did, that would be fantastic, but we usually have to use combinations of different things. So different drugs that we will use to treat disease states include things like medications that affect hypertension or high blood pressure, medications that are kind of considered blood thinners, like antiplatelet drugs such as aspirin or warfarin, and then drugs that also help with high cholesterol or hyperlipidemia. Okay, so we're going to start off by going over some hypertension medications or high blood pressure medications. And this disease state within itself could be definitely more than an hour long. But I know everyone's got things to do, so I'll try to keep it pretty short. So the drug classes that we'll talk about for hypertension meds will be diuretics or water pills, ACE inhibitors, and ARBs. We'll talk about those two kind of together, and then also beta blockers and calcium channel blockers. Okay, so starting off, diuretics. So these are medications that help with blood pressure by helping your body get rid of extra fluid and salt. So by getting rid of that extra fluid, it helps to decrease the blood pressure in your body. These are also, like I said before, called water pills because that's how they work. They help you get rid of extra water. The big thing is that these medications are usually well tolerated by patients. They usually tend to not have too many side effects. Sometimes some electrolyte changes. So if you are on some of these medications, your physician might sometimes tell you to eat like a banana every day or take some potassium. And they can also cause some leg cramps with some patients as well. So for all of the drug classes we'll talk about, I've tried to include a little chart. So you can see the brand names of the drugs on the left side and the generics on the right side. All of these drugs are generic, but I know sometimes everyone refers to things differently. So common drugs in this class are drugs like hydrochlorothiazide, Lasix or furosemide, Oral-Daptone or spironolactone. All of these are generic, so they're all relatively inexpensive. I think hydrochlorothiazide for a while at least was free at Publix, regardless of whether or not you had insurance as well. All right, so moving on, we'll next talk about ACE inhibitors and ARBs. So these are two actually classes of hypertension medications that we lump together basically because they work so similarly. So your ACE inhibitors are your older drugs. So that's mainly lisinopril, benazepril, anything that ends in PRIL. You can see on the chart on the right-hand side. These are great drugs. We've used them for a long time, but probably about 10, 15 years ago, the drug companies started making similar medications that didn't have as many side effects. So these are drugs like losartan or valsartan, and they all end with RTAN. So that's how you can kind of tell them apart. The big benefit of the ARBs over the ACE inhibitors is that they don't cause a cough, which a lot of patients, when they start a drug like lisinopril, might have like a really annoying dry cough. So these new medications in theory don't cause the cough as much. But these drugs all work by decreasing the effects of an enzyme in the body called angiotensin. And angiotensin is essentially a enzyme that causes your blood vessels to constrict or get smaller. And by doing so, that increases your blood pressure. So these drugs block the effects of that angiotensin, so it doesn't cause that blood vessel vasoconstriction. So they work really well at decreasing blood pressure. They work pretty quickly as well, which is nice because you don't have to wait a few days to see any change. And they also have been shown to prevent kidney disease and kidney damage in specific patients, especially those that have diabetes or maybe patients that already have some degree of kidney disease. So you'll see these for a lot of different patients. We love them. Great medications and usually pretty well tolerated. Like I said before, your ACE inhibitors, which on that chart are the first three, are usually associated with a dry cough. The last three, the ARBs, are not associated with that. They can all cause an increase in potassium levels. So if you do get started on one, your physician will probably want to check some labs in a week or two, just to make sure there's no big changes, but nothing to be too concerned about. And then also your ACE inhibitors can sometimes cause an allergic reaction. This is most often in patients of African American descent. So anytime that you're taking one of these meds, regardless of how long you've been on it, if you notice you suddenly have trouble breathing, you feel like you've got tongue or mouth swelling, that is something that you want to keep a close eye on. Obviously, if it gets significant where you can't breathe, definitely a medical emergency. So just something to be aware of. Not super common, but always good to know the risks of these drugs. And you should always be on one or the other, not both is the other big thing with these medications as well. So you would never be on like an ACE inhibitor and an ARB, it would be one or the other. Okay, So moving on, the next class of hypertension medications that we'll discuss are called beta blockers. And kind of real briefly how these drugs work is they decrease how fast the heart beats and how strongly it beats, which by decreasing both of those things, there in turn lowers blood pressure throughout the body. So these drugs are also used to treat a bunch of different things. In addition to high blood pressure or hypertension, they also can help with arrhythmias like AFib. They can help with patients that have chest pain kind of chronically, which is also called angina. And they are also used in patients that have already had a heart attack to prevent further heart attacks. We also use them in heart failure patients. They help with mortality for those patients. And you can even sometimes see beta blockers used for anxiety, especially associated with like flying or presenting in public. So lots and lots of uses for these medications, also very popular. And once again, also pretty well tolerated. Main side effects would of course be like a low heart rate. Usually that's more of like an issue with too much of a dose, not necessarily the incorrect drug, but maybe just need some adjustment with the dose. Some patients say that they feel like their hands and feet can be a little cold after they start them. That's also something that we could probably work with the dose on, so just let your physician know. And they are associated with some constipation, usually pretty fixable though, with just over-the-counter bowel regimens. So common drugs here, I think metoprolol is probably the most commonly known medication in this group. It comes in 2 different formulations, so a twice a day one or a once a day one. No real difference, but I think anytime you can take something once a day, I encourage patients to do so. We also have carvedilol or Coreg, and then the last 2, propranolol and atenolol, not as commonly used, but you may see those as well sometimes. And then finishing up with our high blood pressure medications, we'll briefly talk about calcium channel blockers. So this is another class of drugs that kind of affects blood pressure out of the heart. So these drugs slow the movement of calcium into the heart cells as well as blood vessel cells. And by doing that, it kind of decreases the work of the heart and therefore decreases blood pressure. One question I've received in the past when giving this presentation is, oh, if I'm taking these drugs, do I need to take calcium? And they don't affect at all the amount of calcium in your body. They just affect how fast calcium enters the cell. So not a concern with having to take a calcium supplement. Of course, if you need one already, I would encourage it. But these do not cause low calcium levels. Similar to beta blockers, these drugs can also be used to treat high blood pressure, also arrhythmias like AFib, and even long-term chest pain as well. Common side effects, sometimes patients say that they're a little bit dizzy when starting these medications, as well as they may have a low heart rate. That usually tends to go away within a few days or weeks of trying the medications, but definitely if it's something concerning, let your physician or your pharmacist know. And then swelling can be an annoying thing as well for some patients. So the first one listed here, amlodipine, can cause a lot of swelling, especially in your legs and feet. So a lot of patients won't tolerate this medication because of that. If you're having that, lots of other options we can switch to in this drug class. So just let your doctor know, and we can usually change to something that doesn't cause kind of that annoying side effect. And then real briefly, so other antihypertensives, this is just kind of like a mix of everything else, but I wanted to touch on real fast. There's tons of blood pressure medications, but I know you guys don't want to listen to them all day. But the next class of drugs are called central agonists. These are drugs that just work on receptors within the brain. I think the more commonly known medication here is going to be clonidine. Clonidine is an old drug. It works super well at decreasing blood pressure. The only problem with it is that you have to take it 2 to 3 times a day. So not something that a lot of patients want to take. If you ever do go to the physician and you have like a high blood pressure reading in the physician's office, sometimes they'll give you a dose of clonidine to take it down. Another drug in this class is called guanfacine. Also an old medication, not really used very much for blood pressure anymore, but just for completeness sake, I wanted to include it. The next class are alpha blockers. These drugs basically just decrease blood pressure by causing relaxation of blood vessels. So drugs like doxazosin, terazosin, also not used a ton for blood pressure anymore, but for some of the people in the group, you might see them used for BPH, which is enlarged prostates, obviously happens in men. It can help by decreasing some of those symptoms for patients that need that. And then last but not least, vasodilators. So these are medications that reduce blood pressure by basically causing relaxation of the blood vessels. So they also work very well. Main drug probably that you would see in this group is hydralazine. Works super well, but once again, you have to take 2 to 3 times a day. So for a lot of patients, not a great option. Minoxidil, also very effective. Also, interestingly enough, I guess like your trivia clue of the day, minoxidil is also used. It's the main ingredient in Rogaine, so it helps with hair loss. Not used a ton for blood pressure because of how potent it is. And then last but not least, we have isosorbide, which is similar to like a nitroglycerin agent, can help with blood pressure, but usually more to help with like chest pain for patients that have chronic chest pain. And then someone asked a question about swelling. I think that was probably in relation to amlodipine, whether or not it's annoying or harmful or both. Usually not very harmful. It can be obviously like annoying and decreases quality of life for patients. I think if you are someone that has it, regardless of whether or not you feel like it's severe, I would let your physician know, because there are so many other options that don't cause it. We can easily switch to something that doesn't have that side effect. But good question. All right, so that's it for blood pressure meds. Like I said, that was a real brief overview, and there are many, many more. So if you guys are on one specifically that you do have a question on, you want to chat about, or you just have some questions, as always, feel free to email me whenever. So moving on. So next we'll talk about anticoagulants. So these are drugs that help with how our blood clots in our body. So remember we said way back at the beginning, heart disease causes these buildups of plaque within the blood vessels, and that's kind of what decreases how well blood can travel through those vessels. Whenever you have these plaques rupture, it can cause blood clots, which, you know, in the worst case scenario causes things like heart attacks and strokes because of blocked blood flow to our vital organs. So the way that anticoagulants work is they block your body from making all the factors and enzymes that allow clots to form. So like I said, these are often called blood thinners. The big thing to remember is they don't actually thin the blood. They just affect how fast you can form a clot. So a lot of patients that are on one of these drugs might notice when you brush your teeth or you floss that it seems like maybe you'll bleed for a little bit longer, but it will eventually stop. So these are often used in patients that are either at a high risk of a blood clot or someone that has already had one. So a lot of patients that have had something like a DVT or a blood clot in their lungs, or even one in their legs, will be on a medication like these. Big thing is you wouldn't use this to prevent heart attacks, but you might use it to prevent strokes in patients that have already had a few strokes. So the main drugs here, warfarin, or the first one, is pretty old in terms of drug years now. So I think warfarin's been around since the 60s. It's one of the oldest medications that we're still using today. Great drug, but the problem is that anyone here has ever taken warfarin or knows someone that has, requires a lot of lab tests. You usually have to go once a week or every few weeks to the doctor to get levels drawn, a lot of adjusting the medication. So about 12 years ago, the drug companies came out with these new drugs that are great because they don't require that. So these are the next three that are listed. So Eliquis, Pradaxa, and Xarelto are all newer medications. They are all unfortunately still brands. I think if you watch the evening news, you'll see lots of commercials for these drugs, but they are used very frequently. They're great at helping to prevent strokes. They're great at treating blood clots. We use them all the time. And really for most patients, very safe. Of course, if you're someone at an increased risk of bleeding, that's something your doctor will have to decide. But much better for patient quality of life than a drug like warfarin, just because of reduced need for visits and labs and everything. And then similar to anticoagulants are antiplatelet medications. So also whenever your body needs to form a blood clot, you'll have a bunch of platelets go to wherever that blood clot needs to be formed, and a bunch of platelets will go there and stop it from bleeding. So these drugs help prevent blood clots by preventing those platelets from sticking together. So once again, you can have a clot form while on antiplatelets, but it usually just takes a little bit longer. These drugs are used much more commonly than anticoagulants, and they're useful to help prevent heart attacks or strokes, or in patients that have already had one or the other. You can use them with anticoagulants. The big thing is that it does obviously increase your risk of bleeding to be on both. So just make sure that your doctor and your pharmacist is aware of everything you're taking. I think the big one here that hopefully everyone's heard of is aspirin. So aspirin is used in a lot of different patients. If you watch the news, you always hear like, new study came out that aspirin can help with this or it can help with this. There's so many different needs to take aspirin that I never want to say like everyone listening to this today should go home and start taking an aspirin every day, because you always have to weigh the risks of a drug versus the benefits. But if you are wondering, hey, do I need to take a daily aspirin? Like I said, feel free to email me, or also you can always talk to your physician to figure out what's best for you. And then similar medications would be something like Plavix or clopidogrel, is the more commonly known of the next three. And then we also have Effient and Brilinta as well. So all commonly used medications that work really well for patients. And then that takes us to our next slide. So the question I always get, which I kind of alluded to, so should I take an aspirin every day? So a lot of patients will benefit from taking a daily aspirin, but it's something that you need to chat about with your physician. I know you can just grab a bottle off the shelf, but it still kind of needs to be a discussion between you and your provider. They're great to help reduce the risk of heart attacks and strokes in certain high-risk patients, such as ones that have already had a heart attack or stroke, or diabetics, or maybe a strong family history. But you do want to look at the risks versus the benefits. Of course, risks with these drugs would be like bleeding. Sometimes patients have like a lot of GI intolerance if you take an aspirin, which can even lead to ulcers. And then if your doctor does say like, it's good, let's start an aspirin, just clarify what strength that you need to be on. So for the vast majority of patients, they're just going to need what's called a baby aspirin every day, which is just the 81 milligram dose. It also comes in the 325 milligram dose, which is usually like a high dose that we would use for someone having like an acute stroke or an acute heart attack. But most patients don't need to take that high dose every single day. The other big thing is that it's called a baby aspirin because it's a lower dose, not because it's a dose for babies. Usually you should not give children aspirin unless you're directed to do so by a physician. All right, and then I believe last but not least, we're going to talk about cholesterol lowering medications. And I know that John's probably gone over this with you guys in much greater detail, but just as a quick review, remember cholesterol lowering medications help because when we have bad cholesterol, which is usually LDL, build up in the body, it can block blood vessels because of, once again, that formation of plaques. And that's what leads to all these bad things we've been talking about, like strokes and heart attacks. So most cholesterol medications are going to help to decrease your bad cholesterol or your LDL, and then also increase your good cholesterol, which is your HDL. And of course, they have to be used in combination with a healthy diet. Just because you're on one of these drugs doesn't mean you have free reign to, eat whatever, but everything works best if you combine it with healthy lifestyle choices. All right, so statins, this is by far the most commonly used class of drugs to help with cholesterol. These are medications that help to decrease LDL and increase HDL. And they've been shown to help prevent coronary events such as heart attacks or strokes, and then also improve survival in patients. Very commonly used drugs. We see them quite a bit on almost all of our patients with some degree of heart disease. And they work by decreasing the amount of cholesterol that is naturally made within your body. So these drugs all end with statin, which makes it very easy to remember. So lots of different agents here. I think the two on the top are two of our newest statins. They're both generic now, but they do work better than some of the older agents. So we have atorvastatin, which was Lipitor when it was brand only, and then Crestor, which is rosuvastatin. Simvastatin is probably one of the more commonly known ones. That's one of our oldest statins, but a lot of that's been replaced by use of either Lipitor or Crestor now. So great drugs, they work really well. Side effects tend to be somewhat limited. Some patients say that they have some like muscle pains, cramping after starting them. For most patients, that will go away. If for you it doesn't go away within using them for like a week or two, I would let your physician know, because they can usually just switch to another agent that might not cause those side effects as much, but they are so beneficial for for survival and then preventing events, that we really encourage patients to try to keep taking them and to find an agent that works best for them. Other cholesterol lowering medications. So we don't use a lot of these drugs as much as we used to because statins have been shown to just be so much more beneficial than these other medications. So really these would be for patients that don't get to their cholesterol goals with just the statin alone, or maybe if you really just cannot tolerate taking a statin and you need something else. So our first drug here is called Zetia, kind of a newer medication within the past 10, 12 years, I guess. This drug isn't super strong at decreasing cholesterol levels, but it does help to prevent the absorption of cholesterol in your body. We also have cholestyramine. That's an older medication. It comes in these little packets, and I think it's orange flavored. And you open them and mix them with some either water or juice and drink them. Or Colestipol, which is Welchol, is the same thing and basically a tablet form, but they're pretty big tablets. These drugs work to bind extra cholesterol within the body. Also not super effective, and a lot of patients just don't like taking them because it's either a drink that you have to have a few times a day or these big old tablets, so not super commonly used. Next drug is called fenofibrate. This is brand Tricor, but it's definitely generic now. This drug helps to decrease triglyceride levels specifically and increase HDL. You can see this, it's usually for patients that are on a statin and maybe still have elevated triglycerides. They'll be started on a fibrate in addition to, so somewhat commonly used for some patients. And then last but not least is niacin. This is also a vitamin available over the counter for some people that want to try more like natural options to decrease cholesterol. Niacin works by reducing the production of cholesterol that's made in the liver. The over-the-counter formulation is not really as effective as the brand. And there's also a formulation that claims to not cause as much flushing as the other immediate release ones. I would just talk to your physician about making sure that you're on an appropriate form of niacin, because some of them are not super effective and, you know, could essentially be a waste of money. That's also a great question for your pharmacist. Is this a good brand of niacin, or is this a good brand of whatever vitamin or mineral you're looking at? Because some of those available on the counter are just not worth the money and effort. And then, of course, I have to give my little pharmacist speech at the end of all of these presentations. So just big things to remember with any medication, whatever we're talking about treating. Try to take all of your medications every day. I am not perfect, so I realize how hard this is. There's lots of different strategies we can use to improve compliance. Remember pill boxes. They even have some really cool fancy ones on Amazon now that are like automated. They have alarms and all sorts of crazy things. Of course, cell phone reminders help for a lot of patients to just set an alarm once or twice a day. Remember, a lot of your pharmacies, especially your chain pharmacies, have those automatic refills where they'll just go ahead and refill it for you. That way you don't have to worry about calling the pharmacy to refill the medication. And all of these are important because even missing a few doses of a medication can impact your health, especially if you're talking about a blood pressure medication. Some of those medications, if you miss a dose or two, your blood pressure can actually rebound higher than it was before. So really important to try to take things every day. Other things, if you do have questions, always talk to your doctor. I know sometimes it's not super easy to get a hold of your doctor, but pharmacists are one of your most easily accessible healthcare provider. You know, we're in every Publix and CVS and Walgreens. So if you have questions, we always encourage you guys to ask them. That's what we do this job for. So ask questions like, am I taking medications that are going to help whatever disease state I'm taking? Do my medications interact with each other? Any vitamins that I'm taking? And then even what lifestyle choices should I be making or changing? And then for anyone on the phone call or on the Zoom that does have Gator Care, we'll see if this works. Last time I gave this presentation, it didn't work. So I'll just leave this up for a second. But you can actually go to the Gator Care website. A lot of people don't know this exists, but it's just gatorcare.org. And then click on the pharmacy tab. It's towards the right at the top. And you can actually search through everything that's covered and see kind of, you know, what is the cost, or is this a drug that's covered or not? If the website's a pain, you could always call the number on the back of your insurance card. And the friendly people at Magellan, which is the drug company that helps us with claims, they can also help you. So let's see. So this is, hopefully you guys can see this. This
stop sharing, do a new share.
New share.
Yeah. I think.
So John and I are not technology wizards, but
Well, can everyone see on the screen the Gator Care webpage? I guess that's the best question I asked. Then you can just type it in the
Yes.
chat. Okay.
Yes.
Great.
Thank you. So yeah, this is the Gator Care website. Like I said, pretty easy, gatorcare.org. Great for drug info, but also if this is your insurance, I would encourage you guys to go here to find a lot of things. You can go to this network directory and it shows you all the providers that you can go to that are a network. You know, there's a lot of outside of UF providers, especially here in Jacksonville, you can use urgent cares, things like that, standalone EDs, all this info is on here. And then if you do go to the pharmacy tab, our mouse is not working, but it's this pharmacy tab right here. You just click on that, and then we're trying to get the mouse to work. And then you can look at what expected copays should be for these medications. And then even if you click on this 2022 formulary tab, you can see all of the drugs that are covered. My lovely assistant John here is navigating for us. It's just that first where it's crossed out. Yeah. This takes a second or two to load because it's literally the thousands and thousands of drugs that Gator Care covers. But this can be a great thing, especially if you're in a doctor's office and the doctor says, hey, I'm gonna start you on this new medication. All you do is you just type it in this chat or this search box here. So we'll just start with apixaban, which is a drug we talked about earlier. Anything that's like in all lowercase is usually means it's generic. And then you just hit enter. Once it pops up. And like I said, it does sometimes take a second because of how much info is loaded in here. And you can see, so it shows you all of the strengths that are covered. And then tier, obviously the lower tier that you get is going to be a cheaper medication. So tier 2 is a preferred brand name medication. And then the other thing that you can see is to the right of that, if there's any restrictions on how many tablets you can get a day, how many pills you can get a month, things like that. So super helpful information. If you guys ever have questions about navigating this, feel free to shoot me an email. But probably like one of the easiest ways to quickly get information about what you can actually get with your insurance if you do have Gator Care. If you don't, most insurances have something similar to this. Or like I said, you can always just pick up the phone and call. But I know sometimes this is a much easier option as well. And with that, I think that is all I have today. If you, like I said, if you guys have any questions, comments, concerns, feel free to reach out to me.
May I ask you a question?
Yeah.
It's about the cholesterol. If you have like your whole cholesterol, whatever you call it, is in the healthy range and your LDL is in the healthy range, but your HDL is low, what can you do to increase your HDL?
So the best way to increase your HDL is to exercise more. Even if it's just like walking, any sort of aerobic exercise, you can usually see a change in your HDL for the good way within a few weeks to a few months. So we usually encourage patients to do that. If you are someone that smokes, we also encourage you to quit smoking. But yeah, HDL, very responsive to improvements in exercise and physical activity.
Okay, thank you.
Of course.
If there are no other questions, I want to thank Rachel for taking time out of her busy day to educate us about all the different medications. We will be sending out copies of these slides as well as links to the recordings later on today, which will also include the short little post test that we use for attendance tracking purposes. So again, it's not meant to be something that you have to have stress and anxiety over. It's just a few quick questions about the presentation. You can look at the slides to answer it, that's fine too, but we just use that to track attendance credit and especially use that for anyone trying to get points towards next year's wellness credits. So with that, thanks again, Rachel, for coming in, and everyone else, have a good rest of your day.